Welcome to Connective Care Education. Today we are going to look at Unit 001, Principles and Values of Health and Social Care Adults. Unit 001, Principles and Values of Health and Social Care Adults, Learning Outcome 3, Understanding how to use person-centred approaches. Let's start by looking at the importance of person-centred approaches. The importance of person-centred approaches. Introduction. In health and social care, it is vital that individuals have the right to care to meet their needs, wishes and preferences. It is important that procedures are followed to ensure that needs are met. Individuals should be at the centre of this process, so they feel that they are actively involved in their own care. Good, effective care planning can ensure the criteria is met. Care and support packages should never be made for the ease or convenience of care workers. This is where person-centred approaches apply, placing the individual at the centre of every activity and decisions made. So what are person-centred approaches? Being person-centred is about listening to and learning about what individuals want from their lives and helping individuals to think about what they want now and in the future. Family, friends, professionals and services work together with the individual to make this happen. Individual-centred approaches ensure that the individual is at the centre of all that happens. They involve doing things that sees the individuals using health and social care services as equal partners in planning, developing and monitoring care to make sure it meets their needs. It is about considering people's desires, values, family situations, social circumstances and lifestyles, seeing the individual as an individual and working together to develop appropriate solutions. Beliefs, values and preferences have to be taken into account when using individual-centred approaches when planning to meet an individual needs. How to identify the preferences and backgrounds of individuals, what matters to them and the outcomes that they want. When assessing and planning, it is vital that the individual leads the process. Care professionals must remember that the individual is at the foundation of care planning. It is their body, their discomfort, their life and their care. Care planning, which is not individual-centred, is meaningless and not acceptable. Providing care that health and social care workers think individuals need is not appropriate. Health and social care workers must value an individual's role in this process. This is the best practice. It is essential to empower the individual in their own care. When establishing the preference and backgrounds of individuals, it is vital to ask the child or young person what they want and what they consider their needs to be. Leading questions should be avoided. For example, your after-school arrangements are fully meeting all your needs, aren't they? This may lead to agreement when it may not actually be the case. Open questions are preferred to closed questions, so instead of asking, "Are you happy?" the question could be rephrased as, "Tell me about how you feel at the moment." Please pause the video here and complete worksheet Learning Outcome 3, Worksheet 1, The Importance of Person-Centred Approaches. How to identify what matters to individuals and the outcomes that they want. Health and social care workers should meet with individuals face to face. They should make clear that anything discussed will be confidential. This will reassure the individual that it is okay to divulge any necessary information. Discussions should be in a simple format. Confusing individuals with acronyms, jargon and technical terminology will not help them to lead the assessment. However, workers should avoid patronising individuals by using language that is too simplistic. A balance of clear, detailed information is important. If anything needs repeating, it should be done patiently and clearly. Care workers should clarify and summarise to ensure that everything is understood as well as to minimise mistakes. Where possible, documents should be in a format the individual understands, e.g. pictures, video, written. Workers need to ensure the individual understands these and is given the opportunity to ask any questions that they may have. Establishing consent and why this is important. In relation to the provision of health and social care services, it is important to remember that it is a legal requirement that consent is established before providing support to an individual. Establishing consent is a way that health and social care workers can show they respect the individual. The process of establishing consent is a part of the process of developing trust between health and social care workers and the individual. Consent be given in a number of ways. This can be through verbal communication, in writing, or through actions. The individual might also allow another individual to do something with or to them, perhaps by raising an arm to be supported when dressing, therefore indicating consent. Informed consent is given when the individual understands what they are consenting to. Meaningful and enjoyable activities and experiences. An individual's well-being includes their sense of hope, confidence and self-esteem, their ability to communicate wants and needs, to socialise and to experience and show pleasure or enjoyment. This can involve the activities and experiences an individual chooses to take part in. To promote an individual's well-being, they need to be happy with as many aspects of their life as possible. If the individual thinks that something would help them to feel better, health and social care workers need to be positive, understanding, empathetic and non-judgmental. They should listen to what the individual considers to be important in their lives and help them to make the changes they want, such as being able to join in particular activities or groups, for example. Please pause the video here and complete Worksheet Learning Outcome 3, Worksheet 2, Meaningful and Enjoyable Activities and Experiences. Now we're going to look at co-production and voice, choice and control. What is co-production? Co-production is an approach whereby professionals and individuals work together as equal partners to plan their care, ensuring that they are key decision makers in the process, recognising that both have vital contributions to make in order to improve quality of life for the individual. Co-production is value-driven and based on the principle that those who use a service are best placed to help design the service. What is voice, choice and control? Giving adults voice, choice and control in health and social care is the approach staff in settings use to ensure individuals accessing services get personalised care and support. Individuals need to have their views and experiences taken into account on an ongoing basis to have choice and control in decisions that affect them. They need to be seen as individuals and be given a voice to express who they are and what they want. To enable individuals to have voice, choice and control, interpersonal relationships need to be good between individuals, their relatives, carers and health and social care staff, and between the setting and wider health and social care system. Please watch the video to learn more about choice and control. There is also a link available for you. The importance of knowing an individual's preference and background. Understanding an individual's preferences and backgrounds. It is important that individuals are at the centre of the care planning process so they feel that they are actively involved in their own care. Detailed and effective care planning can ensure all of their needs, wishes and preferences are met, and care packages should never be made without the involvement of the individual concerned. In relation to health needs and preferences, holistic means seeing the whole individual, not just their physical health, but also their emotional, sexual, social, intellectual, mental and spiritual health needs and preferences. This information is valuable when creating the care plan. Traditionally, health has been seen as mostly physical, but increasingly it is usual and good practice to consider an individual's holistic health. Only concentrating on physical aspects of care could miss important needs, and as a consequence, as well as not caring for that aspect of their health, the physical side of an individual's health may not improve. The importance of understanding an individual's background. Being individual-centred is about listening to and learning about what individuals want from their lives, what they did and enjoyed in the past, and helping them to think about what they want now and in the future. The child or young person's experience, history, culture, beliefs, preferences, family, relationships, informal networks and community are all key to establishing a way forward and meeting their needs to enable positive progress. Family, friends, professionals and services need to work together with the individual to make this happen. Behaving towards people with dignity and respect. What does behaving towards individuals with dignity and respect involve, and why this is central to the role of the health and social care worker? We all expect to be treated with dignity and respect, and individuals accessing health and social care services are no different. Behaving with dignity and respect towards individuals involves respecting their views, their choices and decisions, not making assumptions about how they want to be treated, and working with care and compassion. Behaving towards individuals with dignity and respect ensures individuals who receive care and support are able to make choices about the care they receive. This includes decisions about their everyday care needs. If individuals cannot make choices or are not supported to make choices, their care needs are not going to be met. Health and social care workers must ensure they behave towards individuals with dignity and respect to ensure individuals feel valued, regarded as individuals with their own specific needs, and can trust that their needs will be identified, listened to, and met. Ways of working that support person-centred approaches. Person-centred approaches. Individual-centred approaches means working in partnership with the individual to plan for their care and support. The individual is at the centre of the care planning process and should be in control of all choices and decisions made about their lives. The values of compassion, dignity and respect are important when involving individuals in their own care. Decisions should not be made by health and social care workers alone. The individual needs to be seen as an equal partner in their care. Individual-centred planning is about discovering and acting upon what is important to the individual and what matters most to them in their lives. Please pause the video here and complete Worksheet Learning Outcome 3, Worksheet 3, Person-Centred Approaches. Person-centred approaches. The individual should be able to decide what care and support they need. By working with the individual to identify their strengths and abilities, they can make their own decisions. For example, an individual may want to make their own decisions about the activities they are able and want to participate in. The individual has as much control as possible over the choices they make. For example, an individual will be supported to try to use the walking frame. The care plan is needs-led, not service or staff-led. This means that support is identified to meet the specific needs of the individual to make their life better, and not around what is already available or what is easier for staff. For example, the diet planned is what is best for the individual, not what is already chosen by others. Active participation. How are person-centred approaches used to support active participation and inclusion? How are person-centred approaches used to support active participation and inclusion? When supporting individuals, it is vital that the individual is involved in any decision-making and planning in relation to their lives and their care needs. Health and social care workers must remember that the individual is at the foundation of care planning and of all aspects of their daily lives. It is their body, their life and their care. Care planning and practice which is not individual-centred is not supportive of active participation or inclusive. Health and social care workers must value an individual's role in this process. Doing this is best practice. It is essential to empowering individuals in their own care and to ensuring that they feel included and involved at every stage. Individuals are then active participants in their own lives, in their care and in decision making. Please pause the video here and complete Worksheet Learning Outcome 3, Worksheet 4. How person-centred approaches are used to support active participation and inclusion. And finally, the purpose of personal plans. What are personal plans? Personal plans set out how the care of an individual will be provided. They are based on assessment information and care and support plans and will cover personal wishes, aspirations and care and support needs of the individual. The care and support plan is written by a social worker, and from this the personal plans are developed by the health and social care workers involved with the day-to-day care of the individual. The role of the individual in their personal care and support planning has long been recognised as important. It is prioritised as best practice and has been developing as a way forward for all future care and support planning. A personal plan identifies an individual's care needs, the types of services they will receive to meet those needs, and who will provide the services and when. However, since then, the idea that individuals requiring care should be involved in every stage of the planning process has evolved. This process needs to be a continuous cycle, as needs can change. A personal plan meeting an individual's holistic needs when implemented may not meet the requirements 6 months later. In relation to health, holistic means seeing the whole individual, not just their physical health, but also their emotional, sexual, social, intellectual, mental and spiritual health. When we care for someone, we need to consider all of these needs, which can be interlinked. Please pause the video here and complete worksheet Learning Outcome 3, Worksheet 5, The Purpose of Personal Plans.